Laripront is a combination drug with antiviral, antimicrobial, antifungal, anti-inflammatory, hemostatic and mucolytic action for topical use and end practice and dentistry. Active substances: lysozyme, a natural enzyme, mucopolysaccharidase, forming a complex with viruses and preventing their penetration into cells, has an antiviral effect. It has an antimicrobial effect against gram-positive and some gram-negative bacteria due to the destruction of the cell wall of microorganisms. In addition, lysozyme has anti-inflammatory, hemostatic and mucolytic effects due to the blockage of histamine, inactivation of heparin, and the breakdown of mucopolysaccharides. Dequalinium chloride is an antiseptic, effective against gram-positive and gram-negative microorganisms, as well as fungi. Possessing the ability to reduce surface tension, it ensures the penetration of active substances into deeper areas of the mucous membrane. Indications: bacterial and fungal infectious and inflammatory diseases of the oral cavity, pharynx and larynx, stomatitis, pharyngitis, laryngitis, tonsillitis. Fresh, before and after dental and antiparations. How to use: inside, 30 minutes before meals, 1 tablet, keep in the mouth or under the tongue until completely dissolved, every 2 to 3 hours. Within 30 minutes after taking the pill, you should refrain from eating or drinking. Contraindications: hypersensitivity to the components of the drug. Side effects: allergic reactions are possible.